Did you know that over 40 million men worldwide use erectile dysfunction medications regularly? And among them, Tadalafil, commonly known as Cialis, is one of the most prescribed. But here's the question almost no one asks. What actually happens to your body and mind if you suddenly stop taking Tadalafil? Do your symptoms come back? Do they get worse? Or does your body experience hidden consequences that could become serious over time? Here's your heads up. In Chapter 6, I'll reveal exactly who is most at risk when stopping Tadalafil without medical guidance. It might be you, or someone you care about, so stay with me. In this video, we'll break down the physical, emotional, and even hormonal effects of quitting Tadalafil cold turkey, and more importantly, how to do it the right way if you ever decide to stop. Now let's get into Chapter 1. What is Tadalafil, and why do so many people use it? Tadalafil is a prescription medication most commonly known under the brand name Cialis. It belongs to a class of drugs called PDE5 inhibitors, which work by relaxing blood vessels and increasing blood flow, especially to certain areas of the body, including the penis. But here's the surprising part. Tadalafil isn't just for erectile dysfunction. It's also approved for conditions like benign prostatic hyperplasia, BPH, and even pulmonary arterial hypertension in different formulations. So, many men, and even some women, are prescribed Tadalafil daily, not just for performance, but for overall urological and cardiovascular support. In fact, unlike other ED drugs like Viagra, Tadalafil can stay active in the body for up to 36 hours, earning it the nickname the weekend pill. That's one of the key reasons people prefer it. It offers more spontaneity and less pressure around timing. Now here's a quick reality check. Many users start taking Tadalafil not only for ED, but also to regain confidence, improve relationship satisfaction, and even reduce performance anxiety. But here comes a twist. Once your body, and especially your mind, gets used to that kind of support, what happens if you suddenly stop? We'll get into the biology next, and trust me, what you're about to hear might surprise you. Coming up, how Tadalafil actually works inside your body. But first, a quick question to you watching. Have you or someone you know ever stopped using Tadalafil abruptly? Share your experience in the comments. It helps more people than you can imagine. To understand what happens when you stop taking Tadalafil, you first need to understand what it actually does inside your body, beyond the obvious effects. At its core, Tadalafil blocks an enzyme called phosphodiesterase type 5, PDE5. This enzyme normally breaks down cGMP, a molecule that helps blood vessels relax. By blocking PDE5, Tadalafil allows cGMP to accumulate, leading to wider blood vessels and improved blood flow, especially in the pelvic area. Now here's where it gets really interesting. Tadalafil doesn't just affect the penis. It impacts blood flow throughout the body, which is why it can help with urinary symptoms, reduce blood pressure in the lungs, and even improve exercise tolerance in some heart patients. But there's a hidden layer. Tadalafil also interacts with hormones, muscle relaxation, and the nervous system. It influences nitric oxide pathways, which play a role in mood, cognition, and vascular health. And here's something few people know. Long-term use of Tadalafil may train your body to rely on enhanced nitric oxide signaling and blood vessel dilation. So, when you stop suddenly, your system might struggle to adjust, and that's where the real problems begin. Up next, we dive into the physical symptoms people may experience when they quit Tadalafil cold turkey, and some of them might feel completely unrelated, but they're not. So what really happens if you just quit Tadalafil overnight? The first thing to understand is Tadalafil itself isn't addictive. There's no chemical withdrawal like with alcohol or opioids, but your body adapts to the changes it creates, and stopping suddenly can reveal hidden problems. Here are the most common physical effects reported. Return of erectile dysfunction, ED, symptoms. If you are using Tadalafil for ED, those difficulties often return quickly. Some men even feel their ED is worse than before because they've grown accustomed to strong, reliable erections with the drug. Increased urinary problems. For men taking it for enlarged prostate, BPH, stopping suddenly can mean more frequent urination, weak stream, or nighttime trips to the bathroom. Circulation changes. Tadalafil improves blood vessel flexibility. Without it, some users notice more fatigue, cold extremities, or even headaches due to changes in blood flow regulation. blood pressure spikes. In those who were prescribed it for pulmonary hypertension, stopping abruptly can lead to dangerous increases in blood pressure in the lungs, making breathing harder. But here's something surprising. Some men report muscle pain and back pain after discontinuing. Why? Because Tadalafil also relaxes smooth muscle fibers throughout the body, and when that effect disappears suddenly, muscles may tighten again. And remember, the body isn't the only part affected. The mind plays an equally important role. Coming up, Chapter 4. The psychological and emotional effects of stopping Tadalafil. This part may shock you because the brain can sometimes be an even bigger battlefield than the body. Here's the truth. Sometimes, the biggest impact of stopping Tadalafil isn't physical at all. It's psychological. When men get used to the reliability that Tadalafil provides, their confidence often skyrockets. But the moment it's gone, here's what many experience. Performance anxiety returns. Without Tadalafil, some men worry they won't be able to perform. That fear alone can cause erectile problems, even if the body is capable. This creates a vicious cycle. Anxiety, poor performance, more anxiety. Loss of confidence in relationships. Many men tie sexual performance directly to self-esteem. Stopping suddenly may lead to feelings of inadequacy or even shame, straining intimacy and communication with partners. Mood changes. Tadalafil can improve nitric oxide signaling, which also affects mood and blood flow in the brain. Some men report feeling more irritable, down, or fatigued when they quit abruptly. Dependency on the pill. Mentally, not physically. Even though Tadalafil isn't chemically addictive, many users develop a kind of psychological dependency. The thought of intimacy without it can trigger stress, leading to performance problems that weren't there before. Now here's a story you'll want to remember. A 52-year-old patient once told his doctor, "After a year on Cialis, I felt 25 again. But the first time I tried without it, I panicked. I didn't even give myself a chance. My brain shut everything down." That's the hidden power of psychology in all this. And this raises a big question. Who is most at risk if they stop Tadalafil suddenly? Because not everyone is affected the same way. That's exactly what we'll uncover in Chapter 5. Who is most at risk when stopping suddenly? The effects of stopping Tadalafil can vary a lot from person to person. Some men barely notice a change, while others face serious setbacks. Let's break down who is at the highest risk. Men with chronic erectile dysfunction. If ED was caused by conditions like diabetes, hypertension, or vascular disease, the underlying problem hasn't gone away. Stopping suddenly means the ED comes back, often stronger, because the brain was relying on the drug for confidence. Men with enlarged prostate, BPH. For those using Tadalafil daily to manage urinary symptoms, quitting abruptly can bring back frequent urination, urgency, and disrupted sleep. Patients with pulmonary hypertension. This is the highest risk group. Stopping Tadalafil suddenly can cause a dangerous rise in blood pressure in the lungs, leading to shortness of breath, fatigue, and even heart strain. Older men with circulation problems. Since Tadalafil improves blood vessel flexibility, older users with poor circulation may notice fatigue, cold hands and feet, or chest discomfort after quitting. Men with high psychological dependence. If confidence and intimacy rely heavily on Tadalafil, the sudden absence may trigger performance anxiety, relationship strain, and depression. Now here's the cliffhanger. If quitting suddenly carries so many risks, how should you actually stop safely? That's exactly what we'll uncover in Chapter 6, Safer Ways to Discontinue Tadalafil Use. Now that we know the risks, the real question is, how can you stop Tadalafil safely if you decide to? Here are the most recommended strategies doctors suggest. Never quit abruptly without guidance. Even though Tadalafil isn't addictive, your body may rely on its effects. Stopping suddenly without a plan can trigger both physical and psychological rebound effects. Talk to your doctor first. A healthcare provider can check if your ED, BPH, or circulation problems need ongoing treatment. Sometimes the underlying condition requires attention, not just the pill. Gradual reduction. For daily users, some doctors recommend lowering the dose before stopping. This gives your body and mind time to adapt and reduces the shock of sudden withdrawal. Lifestyle adjustments. Exercise, weight control, quitting smoking, and managing stress all improve blood flow and erectile function naturally. Many men notice big improvements when they combine these habits with tapering off. Alternative treatments. In some cases, natural supplements or other therapies can help maintain confidence and performance during the transition. Options like vacuum devices, counseling, or hormone evaluation may also be recommended. And here's something crucial. Even if you stop Tadalafil, it doesn't mean your health or your sex life has to go downhill. With the right plan, many men regain function and confidence naturally. But this leads us to a critical question. When exactly should you seek medical help before stopping? And why could skipping that step be dangerous? That's what we'll cover in Chapter 7. When and why you should talk to a doctor before stopping. Here's the bottom line. Stopping Tadalafil isn't just about the pill. It's about what the pill was treating in the first place. That's why medical supervision is essential. Here are the main reasons you should always consult a doctor before quitting. Hidden cardiovascular risks. Erectile dysfunction is often an early warning sign of heart disease or circulation problems. If you stop Tadalafil without addressing the root cause, you might miss a critical chance to prevent something bigger, like a heart attack. Prostate health monitoring. If you were taking it for BPH, stopping without medical advice could allow prostate symptoms to worsen or hide signs of more serious conditions. Pulmonary hypertension patients. This group is at highest medical risk. Stopping abruptly without a specialist can lead to dangerously high blood pressure in the lungs, which can be life-threatening. Psychological support doctors can recommend therapy, counseling, or even temporary alternatives to help manage the mental side effects of quitting. Personalized strategy. Every patient is different. Some may benefit from a gradual taper, others from a full switch to different therapies. Only a physician who knows your history can make the safest plan. Think about it this way. Tadalafil might just be the tip of the iceberg. The deeper question is, what is your body trying to tell you about your health? And that brings us to our final chapter, where we tie it all together with clear takeaways and action steps you can use starting today. Coming up, Chapter 8. Key takeaways and how to protect your health moving forward. We've covered a lot in this video, so let's bring it all together. If you suddenly stop taking Tadalafil, here's what you need to remember. It's not addictive, but it can still shock your system. No chemical withdrawal, but your body and mind may struggle to adjust. Physical effects can return quickly. Erectile dysfunction, urinary issues, and circulation changes often reappear. In pulmonary hypertension patients, quitting abruptly can even be dangerous. The mind plays a huge role. Confidence, self-esteem, and relationship dynamics can suffer if stopping is not managed carefully. Some people face higher risks, especially men with chronic ED, prostate issues, circulation problems, or psychological dependence. Safe discontinuation requires a plan. Always involve a doctor. Consider tapering off, improving lifestyle factors, and exploring alternative therapies. Here's the empowering part. Stopping Tadalafil doesn't mean giving up your health, confidence, or intimacy. With the right guidance, many men regain function naturally, strengthen relationships, and even improve overall health without relying on a pill. And remember, erectile dysfunction and prostate issues are often warning signs of deeper health problems. Treating the cause, not just the symptom, is the real path to long-term vitality. Question for you. Have you ever considered stopping Tadalafil, or are you currently thinking about it? What's your biggest concern? Share your thoughts in the comments. Your story could help someone else. If you found this video valuable, don't forget to like, share, and subscribe for more science-based health guidance.